children face a growing number of health challenges.
The gut microbiome is an ecosystem of trillions of tiny microscopic organisms in our gut. Our probiotic species can make many of our B vitamins and vitamin K for us. When babies are exposed to antibiotics very early on in the first 6 months of life, that can significantly increase the risk of eczema, asthma, allergies later on. Serotonin, which some in the audience may know, is our feel-good, keep relaxed, manage stress. 80 to 90% of that is made by our gut microbiome. Antibiotic resistance will become a leading cause of death worldwide. An exercise in nature is more effective than an SSRI medication for anxiety and depression.
In each episode, we dwell into the realms of wellness, exploring the latest trends, expert advice, and practical tips to help lead you a happy, healthier life. We aim to bring a broader perspective to our American audience on issues that impact your daily life by interviewing guests from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your lifestyle, you're at the right place. Join us as we embark on a journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together let's unlock the secrets to living life to its fullest. In today's world, children face a growing number of health challenges, developmental, behavioral concerns, and then a weakened immune system. Emerging research highlights the crucial role of the gut microbiome in shaping a children's overall well-being, influencing everything from digestion, immunity to brain function, and then emotional resilience. Yet, conventional medicine often treats symptoms rather than addressing the root causes. A holistic, integrative approach may be the answer. It may focus on nutrition, lifestyle, and of course, the microbiome. It may even offer a powerful way to build stronger, healthier kids. Welcome to another episode of Khanklinics. I'm your host, Dr. Amir Khan. My guest today is Dr. Elisa Song. She is a Stanford, NYU, and a UCSF trained integrative pediatrician, renowned for her holistic approach to children's health. She's the founder of the Whole Family Wellness, an integrative pediatric practice in Belmont, California, where she has helped hundreds and thousands of children achieve optimum health by combining the conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. Dr. Song earned her medical degree from New York University School of Medicine. She completed her pediatric residency at UCSF and holds a master's degree in public policy. In 2024, Dr. Song authored the national bestseller, Healthy Kids, Happy Kids, an integrative pediatric guide to whole child resilience. Welcome, Dr. Song, to our program today.
Well, thank you so much for having me, Dr. Khan. It's an honor.
Let's dive into the fascinating world, Dr. Song, discover how we can support a child's growth and development. And the question first would be, explain us what's a microbiome, and then please, how is it important?
So, the gut microbiome is an ecosystem of trillions of tiny microscopic organisms in our gut. We do have microbiomes all over our body, on our skin, in our hearts, but the gut microbiome is the most well studied. And for infants and children especially, how the gut microbiome shapes influences significantly how their immune systems will shape and even how their brains will develop. And just for an example, we know the impact of gut microbiome disruption when babies are exposed to antibiotics very early on in the first 6 months of life. That can significantly increase the risk of things like eczema, asthma, allergies later on. We also know the same for the developing gut-brain connection when there's a disruption in the microbiome through antibiotics. Again, in those early years, that can significantly increase the risk for developing mental health concerns like ADHD or anxiety or any number of concerns by the time they're older kids and teenagers. And it's really the foundations of how the microbiome develops, which we actually can influence if we have the knowledge, that informs the immune system to stay calm and respond appropriately, also informs our brain development. And when we're thinking about what's going on with our children, if we focus on their gut microbiomes at all stages of life, they're going to be as healthy and happy as possible.
Excellent. Thank you for explaining that. So the gut microbiome, would you just give just an overview of what does that entail? And you mentioned that there are trillions or hundreds and thousands of bacteria in it. Give us an overview to a layman person. What does it mean? And then how does it influence? You mentioned that it does affect, we got to be mindful about it. So how would we explain what's a microbiome to our audience?
Yeah. So the microbiome is the collection of these microscopic organisms that's our microbiota. Okay, just for in terms of language, but a lot of people will interchangeably use microbiome to mean the organisms in your gut. Now, there are trillions of these organisms, and we would like them to be friendly organisms. So the friendly bacteria, many of our audience will know about probiotics. These are beneficial bacteria that confer health benefits to us. And so ideally, most of the bacteria in our gut are these friendly bacteria, our probiotics, which actually make many, many substances for our health. For instance, our probiotic species can make many of our B vitamins and vitamin K for us. They can make these compounds called short chain fatty acids that fuel our brain and our metabolic health. And really significantly, they make the vast majority of many of our neurotransmitters, which we think of as brain chemicals. But when we think about something like serotonin, which some in the audience may know is our feel good, keep relaxed, manage stress hormone, 80 to 90% of that is made by our gut microbiome. And so if we want our brain to be, and our children's brains to be as calm and resilient as possible, we need to make sure first that their microbiome has the beneficial organisms to make all of these beneficial byproducts for our benefit. Now, on the other hand, we can have not such good organisms. That's what are called dysbiotic organisms. And those can include abnormal bacteria in the gut, many of which can, if there is an overgrowth, can increase the risk for allergic diseases and autoimmune diseases, even neuropsychiatric conditions. We can also have other types of organisms that aren't just bacteria, but maybe an overabundance of yeast in our gut or parasites in our gut. And we're identifying other organisms as well that reside in our gut. So what's really important is that we have a proper mix of these mostly beneficial bacteria and some of these bacteria that we consider not such good bacteria. Sometimes we need a little bit of them to train our immune systems to really, help inform how to react. So when we think about the core of our health, it really starts in the gut. And that's, where we think about with functional medicine, health starts in our gut. And even if your child has no gut symptoms, their tummy feels fine, they're stooling normally, everything seems okay.
Sure.
And yet they have eczema or they have anxiety or they have behavior concerns. We still need to start with the gut microbiome.
That's fascinating. I think you open up a very brilliant discussion about how diet affects even from an early age and what kids eat, what they absorb. You're saying that they are friendly bacteria, they are probiotics, and then they are dysbiotic organisms that have some role, but you want to make sure there is a balance because wow, I mean, it can affect your brain, it can affect the vitamins that you absorb, and of course, infections. You mentioned yeast and parasite. So thank you for explaining that. I think the main question would be, what should parents be concerned about and watch for when we are talking about a child's microbiome? What should they be looking for? What is the first thing you tell your patients?
The first thing I tell my patients, the kids in my practice and the parents, is that yes, there are factors in our world that really act to disrupt our gut microbiome. And yet there's so much that we have in our control that we can really create this foundation of microbiome resilience so that our kids can be resilient. And when I talk about what are the ways that we can impact our gut microbiome for the better, I talk about the 5 things for microbiome magic. And these 5 things, they're 5 things that we're already doing every single day. We have to eat every day. We have to sleep and move our bodies, hydrate every day. We have to breathe every day. And so I'm not asking parents or kids to do an additional thing. I'm just having them think really thoughtfully in a practical, really simple and fun way. How do we do each of those things so that we are nurturing our gut microbiome, taking care of this little world inside of us so that world can then come back and take care of us? And so just breaking things down and really starting where kids are at to see, well, where do we want to focus first?
What everyone should do, but you're just emphasizing, hey, parents, don't forget this because this is gonna affect your kid's microbiome, and indirectly that offshoots to a number of other little things. Thank you for explaining that. Dr. Song, you just mentioned earlier about the impact of antibiotics on the microbiome. Are we saying we should not give the kids then antibiotics? And if we do have to, what other things are we worried about? And how would you protect child's microbiome in that
Mm.
circumstance?
Yeah, that's a great question because I am an integrative pediatrician, which means that I do integrate conventional pediatrics with functional, more holistic approaches. And that means understanding that there absolutely is a time and a place for antibiotics.
Mhm.
The issue in our modern world, though, is recognizing a couple of things. There's 2 main issues with antibiotics. The first is a public health perspective, where because of the overuse and misuse,
Yeah.
inappropriate use of antibiotics, we are really at the point that in just a couple of decades, antibiotic resistance will
Mm.
become a leading cause of death worldwide. And the World
Wow.
Health Organization is really calling for judicious antibiotic use and an awareness of this because we don't want to go back to a time before the invention of antibiotics where even simple infections could become life threatening. So that's a public global health perspective. And then, of course, for me as a pediatrician, I see this child in front of me. And what we have to understand with antibiotics, especially when it comes to children, where some studies have shown that 70% of antibiotics for children are inappropriately prescribed,
Wow.
mostly because they're prescribed for viruses. I mean, the vast majority of illnesses that children will come across are viral illnesses for which antibiotics don't do anything.
Wow.
And and we have to really understand then the consequences to their microbiome because
Sure.
antibiotics don't really pick and choose which bacteria that they're going to kill. Of course, we would like them to kill the bad bacteria that may be causing your child's pneumonia or
Yeah.
ear infection. However, they can also kill all of the beneficial bacteria and to wipe out those probiotics in your gut. And we do know that after antibiotics, children and adults in the time after have an increased risk for mental health problems, developing depression and anxiety. So, if
Wow.
we learn, as you said, to really restore, the first key is learning how to use antibiotics appropriately and judiciously, making sure that they're absolutely necessary. And when they are, empowering ourselves as parents and kids and educating ourselves as physicians to know how to restore the gut microbiome back to health so that they don't have any downstream future consequences from that microbiome disruption.
What a brilliant response. I mean, you mentioned how 70% of the antibiotics are not given appropriately. What would you tell those parents who actually go to the doctors looking for antibiotics because they want a quick fix solution? And in
Yeah.
their minds, their doctors are being negligent or not being concerned adequately. Not to mention, parents are forgetting what could be the negative impacts of this.
Yeah.
So,
Yeah, I
so
mean, I
that
think that's such an important issue. I think that the more that parents can educate themselves about antibiotics and about children's gut microbiomes, it makes it more easier to understand that we don't necessarily want an antibiotic for every single illness. Now, when it's appropriate, for instance, if your child has a strep bacteria in their throat, absolutely, I'm going to prescribe antibiotics. But recognizing that most of the time your child has a virus, antibiotics actually won't help your kids get better faster, and it can disrupt their microbiome so that maybe not immediately, but a few months from now or a couple of years from now, or maybe when they are an adult, it sets the stage for their gut microbiome not appropriately educating and training their immune system and their brains so that we can have problems down the road. Even for the gut microbiome connection with hormone health and metabolic health, which we know as teenagers and adults, our metabolic health with obesity, overweight, type 2 diabetes, hormone issues like thyroid issues. So many women have PCOS. There's an intimate connection between how healthy their gut microbiomes are and how healthy their hormones and their metabolic health really responds. So we want to think long term for our kids. Just like when we have a child in front of us, we're not just thinking now, we're thinking, how do we get them to be successful adults when they're on their own? It's the same thing with their health and their microbiomes.
brilliant. But thank you for explaining that, because it is important for parents to know that if my kid has a virus, you want them to develop that resilience. You want them to develop that natural innate immunity and try to fight it on its own before we try to supplement it with something. So, absolutely. I mean, that's very well said. And thank you for explaining that. Dr. Song, you mentioned that you are a very successful pediatrician. You practice conventional pediatrics, which is the regular medicine that you practice on a daily basis. How do you explain functional medicine to your patients' parents? And how do you persuade them to keep that as a part of their care, the kids' care? Tell us a little bit about it, and what difficulties do you encompass or come across, and how do you overcome them?
Yeah. So, I see children for well visits where they are well and parents are already looking for a pediatrician who has a more integrative approach. So, with that, there's not really, these parents are seeking out that care, which is great. They understand that I will use antibiotics and medications when necessary, but I can also incorporate supplements, diet and lifestyle. I do actually incorporate homeopathy, essential oils, acupressure and acupuncture, and herbal medicine into my practice as well. It's about knowing what is appropriate when, and also working with families, because I have some families who say, I think maybe I am not so interested right now in essential oils, but maybe later, right? And so working with families is absolutely key, and individualizing care. And that's where functional medicine comes into place. It really allows a more personalized approach where, if I have a child who comes in with eczema, let's say, which is so common, at least 1 in 5 children is diagnosed with eczema. From a conventional pediatric approach, conventional pediatricians are not trained to understand, why did this child develop eczema in the first place? Do they have food or environmental allergies or food sensitivities? Is something going on with their gut microbiome? Is it maybe some, environmental exposure that's triggering some of their eczema? So and in conventional pediatrics, the only tools we really have are steroid creams that suppress symptoms. Of course, your children's skin is going to look beautiful after steroids, but it doesn't do anything to improve what's going on in the inside and prevent that eczema from coming back. So, a functional medicine perspective understands that the key to healing is identifying whatever the root causes are and the clinical imbalances are for your child, for your unique child in front of us, and figuring out how to balance out so we can reverse some of those imbalances. We can nourish and nurture their microbiome, replace any missing nutrients that your child's skin needs to heal, and really moving forward with the intention that we want to heal from the inside out, not just provide band-aids to help them feel better temporarily.
Brilliant. Thank you for explaining that. Fascinating. Dr. Song, you mentioned diet and oil essentials, and then separately you mentioned acupuncture, the role of acupuncture, and then some herbal medicine.
Mm-hmm.
I know it's a discussion on its own, a functional medicine, and how you could practice that, or one should be aware about these essential things that you highlighted. Could you just give us a brief overview about the diet and oils, and of course, the herbal medicine that you integrate into your practice? Just an overall approach to how you look at
Yeah.
these components.
So, for any condition, I really try to dive into the research. And we know that research often can lag 17, at least 17 years, they say,
Hmm.
for research to get translated into what we see in practice, in the
Sure.
hospitals, in the clinics. But I do try to comb the literature for evidence about different herbs, foods, different homeopathic remedies that can be really
Yeah.
helpful for particular
It's existed
conditions.
for years and years. The Chinese, the conventional old medicines, and then the Germans and everything. There's no doubt it's existed. Our research latest may not be up to date with it.
Yeah, that's so important to recognize too, because um, the research really depends on who's funding it, right? And for a lot of these herbs where you can't get a patent, or homeopathic remedies, or I mean, and also when it comes to children, research around children lags very far behind research for adults. So a lot of times we're extrapolating what has been found to be successful in adults and trying to really look at that for children. And I always explain to parents that, this term evidence-based medicine, which really came about when I was in medical school, back in 1996, there was no such term as evidence-based medicine. I remember the discussion around how should we define this? And the definition of evidence-based medicine is it's a three-pronged, like a triangle. We have the research. Of course, we want the best available research, but as you said so aptly, a lot of times the research isn't there yet. So we want the best of what's available. We also really factor in clinical evidence. And I've been doing this for 20 years. So I see the patterns of what works and what doesn't work. And of course, we also want to take into account parent preferences, because I have parents who have come in and they've used acupuncture their whole lives themselves. Maybe they grew up in a country where that was part of you, just from the moment you're a child, you do. And so that's their preference. They want to start with that. Or families who have used herbal medicines and teas, growing up, just whenever they were sick, grandma brewed a tea. They didn't know what was in it, but it was an herbal tea that helped them feel better. Right. And same thing with homeopathic medicines. And so one example that maybe will be a little more clear is, let's take, the common cold or flu-like illness. In conventional pediatrics, there's really nothing we can do except kind of wait and watch and hope your child will get better, and not get dehydrated. From an integrative standpoint, we know that there is this homeopathic medicine called oscillococcinum, which in the studies actually have shown to reduce the symptoms by 48 to 72 hours, faster than placebo. We also have an herb called Pelargonium sidoides. Now that's it, that you can find this over the counter at CVS or, Walgreens, called UMCA at Whole Foods, UMCKA. It's UMCA cold care syrup. Now this herb is fascinating because in the literature for children has been found to significantly reduce their viral symptoms and respiratory symptoms like coughs. And when we look at in vitro in the laboratory, this herb has been found to have activity, meaning kill many, many different viruses, including the common cold viruses, adenovirus, rhinovirus, coronavirus, influenza virus, Coxsackie virus, which is the hand, foot, and mouth virus, a number of very common childhood viruses, and also some activity against some bacteria, including staph and strep. Very good side effect profile. So of course, let's incorporate this into our protocols for our children. And same thing with acupressure points, that can really help have been shown to reduce headaches or reduce fevers. and essential oils that can help with calming and reducing inflammation. And so I try to incorporate all of that. It's not to say that parents have to do every single thing, but I teach parents about what can be helpful, what can be effective, what I've seen in my own children and the patients in my practice over 20 years to really help. And then we incorporate those, and parents can then see for themselves what works best for their own kids. Because I mean, I've had some parents say, oh my gosh, this Chinese herbal medicine you use, this is so good, I'm not going anywhere without it. And then for other families, it's the homeopathy or it's the pelargonium.
Dr. Zhang, fascinating. Tell us how you use integrative approach for stress and anxiety among children. One of the other common conditions now more prevalent in kids than ever.
Yeah,
What's
this
your
is such an important topic because, it's when kids are young, as parents, we're often worried about their viruses, the colds and the flus and the fevers that they get. But as they get older, even into elementary school, middle school, and certainly into high school, it's the mental health concerns that become really the main priority. Anxiety is really at an all-time high, and our kids are in crisis. And so we know that, I mean, medications may be indicated. However, especially when you have a young child, let's say in elementary school or middle school with a lot of anxiety, first of all, a lot of these medicines haven't been studied in children. They're used, quote, off label. And we also know that for children and teenagers and young adults for that matter, when they start an SSRI type of medication and for anxiety or for depression, we know there's something called a black box warning on it that it can increase the risk of suicidal thinking and
Sure.
suicidality. So we have to be very mindful of that. And there may be an appropriate time, but we have to watch our kids for sure. And from a functional medicine integrative standpoint, we go back to, well, what is going on first in their gut microbiomes, right? That because when we have anxiety, typically there's an imbalance of our neurotransmitters, especially serotonin. And as we mentioned before, the vast majority of serotonin is made in our gut microbiome. So if we can help support their gut microbiome and know that if we can help replace some of these probiotics that produce our neurotransmitters, your brain is going to have a lot more there to begin with to manage the stress. We also look at, well, what about nutritional deficiencies? We know that there are certain nutritional deficiencies that are very common in children, including zinc and magnesium and vitamin D and omega-3 fatty acids, all of which, if they are down at the bottom of the normal or outright deficient, can absolutely impact how your kid's brain is functioning and what their mood is like. So we need to think, how do we optimize that? Either with food, or sometimes we'll need supplements to replace. And then, also looking at, what are the what are the lifestyle factors that are really going on? We need to make sure that parents and kids understand the power of sleep and exercise. In fact, exercise, there are studies showing that exercise, especially if you can exercise in nature, is more effective than an SSRI medication for anxiety and depression. So why not? There's no side effect except maybe your legs get, a little tired, right? But then
Yeah,
you get stronger and stronger.
stronger,
So
right.
we need to understand that some of the most simple interventions are the more powerful, and it doesn't require a pill. And so, that's where this functional medicine approach, I think, really holds the power to help our kids for the long term.
Excellent. Well, brilliant answer. And I'm sure our viewers will understand that whether it's serotonin, whether it's dopamine, they're all are gonna, these neurotransmitters are at the end of the day essential, and they're produced, they're stored in the gut, they have a connection. And there is going to be some cognitive functional defects. There is going to be some emotional health related issues if there is deficiency. So you put it very nicely that with sleep and that you're doing your exercise is only going to make your gut stronger
Mhm.
and enhance these transmitters and essential other things you mentioned, zinc, mag, fatty acids. They just all have such an important role in the body. Dr. Song, we're running out of time, and I know you're busy practicing as well. I want to just ask one or two little other questions. Your concept about the whole child resilience, and your key components, and the approach that you use. What do you tell your parents?
So the concept of whole child resilience is really an important one for us as parents and as pediatricians. It's never fun watching your kids be sick or stressed. But what we have to understand is when our children can go through an immune stressor, a physiologic stressor, a psychological stressor, and have the tools to overcome that, they build resilience so that their bodies and their brains and their immune systems actually learn how to handle the next stressor even more effectively and efficiently. It builds a memory to do that. So our role, I truly believe as parents, is not to protect and shield our children from every single stressor, because that does not build resilience on any level. It
Mhm.
is to build the foundations from a gut microbiome standpoint, a psychological mental health standpoint, and a physiologic standpoint, so that whatever comes your way, they are equipped to manage it and then overcome it and bounce back quickly and completely so that they're even stronger for the next time.
Excellent. One comment. I know we ran out of time. Bifidobacterium infantis. Your thoughts about it before. Your
Yeah.
thoughts, and how would you explain that?
Well, so Bifidobacterium is a family of beneficial bacteria. And there are many, many different strains of Bifidobacterium. There's Bifidobacterium infantis, which, as you can imagine how it sounds, it's very important for infants. There's Bifidobacterium adolescentis, which is really important for our teenagers. Now,
Mhm.
Bifidobacterium is one of our primary beneficial probiotic species and categories that are so profoundly important for your child and actually adults' immune systems and brains. In fact, there have been studies looking at the loss of bifidobacteria over the centuries in our infants and how that's really disrupting how their immune systems function and how their brains function. Same thing for adults. Adults' recovery from serious infections is correlated a higher risk of having serious outcomes if they have less bifidobacteria in their gut. And bifidobacteria in an infant will help train their immune systems so they build tolerance to foods and other environmental toxins and don't develop anaphylactic food allergies or eczema or asthma. And we're finding that if we can identify that and replace the bifidobacterium, it really helps support healthy gut brain and gut immune system development, especially for our babies. And this is another way to think about how important bifidobacterium is that human breast milk, which is designed to be the perfect food for babies, is
Yeah.
chock full of a prebiotic called
Mhm.
HMOs, human milk oligosaccharides. Now, these HMOs
Mhm.
are in breast milk from an evolutionary standpoint. They only feed bifidobacteria because
Excellent.
babies should have almost all bifidobacteria in their gut. And if something goes wrong and there's less bifidobacteria and more of other bacterial strains that take hold, we can see then that that sets the chain reaction for future problems.
Fascinating, fascinating discussion. Thank you very much, Dr. Song, for coming on our show. Really, time flew by. Valuable insight, brilliant discussion. Any final comment?
Well, I want to make sure that parents know, and kids and teenagers for that matter, we have to empower them as well, that no matter where you're starting from, even if as you're listening, you're thinking, oh my gosh, well, my child was on a lot of antibiotics when they were younger, and now they have eczema or behavioral problems or anxiety, it's never too late to restore your microbiome. Even as an adult, I have parents who say, oh my gosh, I had antibiotics, they were given like candy to me when I was a kid, and now I have all these health problems. When we know to look at the gut first, then we can start the healing process. And again, it's never too late.
Excellent. Dr. Song, thank you so much for your time. Appreciate your presence. Appreciate all the valuable suggestions you have given us.
Thank you so much for having me.
And thanks to our amazing audience for tuning in for another episode of Khanklinics. If you enjoyed the show, please share it with your friends. Give us your thumbs up, hit the subscribe button, and feel free to drop your comments. We always love hearing from you. Don't forget to spread the word, tell your friends about us. Thank you and have a good evening.